When you look at standardized testing, assessment results typically point to specific impairments. And instead, we're focusing on function and using the results to point toward and support the goals that will be chosen for a treatment plan that supports maintaining the person's functional communication, independence, and quality of life in the person's preferred living environment for as long as possible. And I see sometimes with standardized testing that clinicians have difficulty taking that information from the specific tasks and then making that leap to practice interventions in therapy. So let me give you an example. On one of the assessments that we often give, we ask clients to copy a cube. And I hate when I see people report that, client was unable to copy the cube shape on the screening. Instead, think about what skill set that copying was actually measuring and incorporate that information with other outcomes.
For instance, if I tell the person to pick up a paintbrush, dip it in water, and paint a line on a piece of paper, and they keep asking me, what am I supposed to do? And I tell them again, and they say, you did not tell me that before. Why are you lying to me? I can try and reason with them, or I can learn to see that I am not communicating with them very well. They have dementia and are forgetting the sequence of tasks I gave them. So I could argue with them about that, but we know arguing never works. Or I could show them, by me picking up a paintbrush, that the first thing they are going to do is pick up the paintbrush. Then I say and show dipping the paintbrush into water, and I ask them to do the same. This way, I am learning to see the abilities of the person and work with them at a pace they can handle, rather than trying to change them.
So in this program, we make use of cues to let the person know what to do so they can be more successful. And it really releases them then to be creative. So here is two examples of the environment. So think about what differences that you see in these two photos and which environment you think would be more appropriate for someone with dementia. In photo one, it's clutter-free. Okay? There's high contrast, so we have a dark blue tablecloth and white paper, as well as bright pink paint on the black plate. There's no extra supplies scattered around like jars of paint or cups or extra material. Okay, the tablecloth isn't patterned or messy, which can be very distracting. So photo one is setting someone up for success. Photo two was not a staged photo. Photo two is a typical scene. You have a cluttered table, there's supplies all over, there's multiple colors of paint on a patterned paper plate so the person can't see clearly where the plate is, where the paint is. The messy tablecloth that's white and the paper's white. Person's not going to know what to paint on. There's excess paint on the tablecloth from other projects. So it's confusing. The person with dementia may pick at the tablecloth or think the previous paint is something that they're supposed to use for this specific project. So in this next video, Katie shows some great examples of our guiding principles while working on one of the Creative Connections projects.
It reminds us, again, to do fun things that we can create. We also use the things that we have created. I send out these cards then to our family and friends that we've made, and we'll say, Bob and I made this. And I think that has a special relationship that is forged with the people we send.